Okay, hello everyone and good evening. Thank you for joining this Behavior Analyst Leadership Council event. My name is Jim Hoko. I'm the Executive Director of the Behavior Analyst Leadership Council, which is a trade organization that has been founded in 2015. We've had multiple conferences in the Northeast. We were set to go to Boston right when this pandemic hit, and we're not able to do that, but we are scheduled for Miami in 2022. So I'm hoping that that is going to take place. We are an organization committed to supporting behavior analysts serving as leaders, managers, and business owners. What our purpose is to support behavior analysts in these roles through our triad of excellence. And that triad is effective leadership, clinical acumen, and operational expertise. So now what I'd like to do is to introduce the moderator for our panel this evening, and that is Suzanne Letso. Suzanne is a board member for the BALC and a founding member, among many other things, which if she wants to, she can tell you about. Suzanne?
Good evening, Jim and everyone. Thank you for coming. I'm the CEO of Milestones and the Vice President of BALC, and I will be just moderating tonight. We are joined by an excellent panel. We have Gregory Hearing, who is an attorney in Florida who specializes in employment law and has a specific expertise in COVID and all things related to what our lives have been like for the last year. Phil Orlando is an insurance company owner who works in a bunch of different states. Amy Allen is a human resource specialist who helps a lot of organizations. She worked with us, which is how I met her in the first place, but she goes all over the country. She's presented at other BALC events, and she's got a wealth of knowledge on HR and COVID related circumstances. Heather Woolsick is a vice president of an organization. Heather, I don't remember all the states, so I'll let you say it when you come on. But if each of you would like to turn your cameras on and just, introduce yourselves in a sentence or two, and then we'll jump right in. Amy, you're in the top left for me, so you go first.
Great. Thank you, Suzanne. Nice to be here, everyone. As Suzanne said, my name is Amy Allen. I'm a 30-year human resources expert and executive, working in a variety of different industries and in states across the country. Currently working as an HR consultant and really happy to share this knowledge tonight. So thanks for having me.
Greg?
Good evening, Suzanne and attendees. I'm Greg Hearing. I'm over 30-year labor and employment law lawyer with Gray Robinson. I exclusively represent management. And so tonight, I'll go ahead and warn you all, I have a very strong management bent. So I will be advocating for employers, not employees this evening.
Heather?
Hi, I'm Heather Woolsick. Thank you for having me, Suzanne and BALC, and hello, everyone. I'm the Executive Vice President of Business Operations for Behavioral Learning Network. We service children ages 2 to, I think, about 27 now, in California, Oregon, Massachusetts, and New Hampshire. And we provide focused and comprehensive applied behavior analysis.
Bill?
Good evening, everyone. Thanks for having me part of the panel tonight. I'm the CEO of Quantum Benefits. I've been in the benefit insurance space for about 23 years. I've worked inside carriers, worked inside agencies. We have our own insurance agency up here in Connecticut, but work with companies all around the country, helping them with their benefit programs for their employees, and really for any size business. Our smallest employers are 2 lives right up to 1,000 life companies.
So the way we're going to do this is that we have some questions that have already been sent in to us. We'll start with those. In the meantime, if you have questions, you'll type them in via Facebook Live, and Jim will give us the high sign that we have another question coming from the audience. But in the meantime, I'll direct a question to one of the panelists to start, but then we're hoping that if you, another panelist or all of the panelists have something they would like to add, please jump in. So my first question is sort of a global one. What has been the most surprising to each of you that has impacted either your organization or your clients who work in the field of behavior analysis or something related to that, that surprised you in relation to your workforce or to their workforce? Phil, would you take this one first?
Sure. And really, this goes just beyond any specific industry. I think what was very surprised at right out of the gate when this hit was the unpreparedness for everyone in terms of their business. The quick reaction to either workforce reductions or furloughs because, to surprise, seeing that people had 30 days of operating cash and no real contingency plan or disaster plan. So that was the first thing. We did see, companies that unfortunately did have to go out of business. We saw companies that did have to have mass layoffs. But I think it was an eye-opener for everyone from that standpoint of what to do when something like this happens to protect their workforce. And really, what is scary in this case was if you were talking about letting people go, we're talking about letting people go as people are getting sick and losing benefits and being concerned about how they're going to afford to pay for benefits when they're staring down a pandemic. So it really, the overall preparedness of companies to take something on like this, we've seen it happen in other countries, but I think we had this attitude that it was never going to happen, in our backyard. So that was one of the first things that really jumped out. The second thing around telehealth, which a lot of us have gotten used to now, and the quick adoption of that. But again, it's been here for a while, and people not being prepared to make that shift early on into start using the telehealth benefits that they had to maintain their connection with their providers and with the healthcare systems.
Yeah, Suzanne, I'll jump in. Similar to what Phil said, even though it was surprising, sort of the shock and awe of how quickly it hit and everybody needing to scramble to figure it out and the lack of a preparedness, I was really pleasantly surprised with how quickly people adjusted to remote working where they could. It wasn't everyone in this space that had the ability to do remote work, but those that were adapted pretty quickly. And the ability for the technology to ramp up. I don't know if you all remember, but the first few weeks of this, Zoom almost crashed. Every funny video on Instagram was about a Zoom fail. And Zoom was really, able to quickly pick up and fix the things that were going wrong. And I credit not only Zoom, but, Google Meet and GoToMeeting and all of the capabilities for people to stay connected and really make the work from home work. So that was one of the biggest surprises for me, again, cross industry.
I'll jump in. I'd like to say that I was pleasantly surprised by how resilient our entire team was and how everybody was open to change. And the word of the day became pivot, because every day we were pivoting. But everybody came together to keep the company running. And more importantly, to keep providing services to those who so desperately needed them. And everybody jumped on board with technology and the utilization of telehealth. And it was, as much as it was a challenging and has been a very challenging time, I think it's been a great growth experience for the company.
Greg?
Sure. In my industry, law, I'm surprised by a couple things. We are doing everything remotely, and it's really worked well. And I'm surprised because, I have these gray hairs from working with a lot of people very closely for over 30 years. And the collegiality is very important, and especially, creative thinking in terms of what we do in the law. And we've been able to do that well, even remotely. And then secondly, within my industry, I've been surprised pleasantly how management and employee side groups have worked so closely and well together over this pandemic and rising up to overcome for both sides, which has been great. And I've been surprised that there hasn't been more litigation, frankly, over it. I'm afraid that that tide is coming, but at least so far, it hasn't. There hasn't been much, so it's been great.
You guys are just reminding me of what it was like the first few months, where every day you'd get up, you'd solve all the new problems of the day, and then like you'd get a text and be like, done with that, start over. Think how far we've come. Y'all should take a great deal of pride in that we're still here. All right, so one of the questions that's come up a lot in the last couple of weeks, and Greg, I'm hoping you'll take this one first, is can we, should we, shouldn't we mandate vaccines for our staff?
So the short answer is yes. Under federal law, you can do this if you, so you can. Should you is the better question, because you've got employee morale issues. And by the way, this is sort of academic right now, because as you all know, first these vaccines were rolled out to healthcare, and now they're being rolled out into minority communities through pharmacies and things like that. Education is getting some of it, so it's limited. And maybe in your industry, you're already getting the opportunities because you are, of course, healthcare related. And so, what I've found though is I represent several large hospital systems, and they have gone with voluntary vaccines. They've said, we're not going to make you do it yet. And the interesting thing to me, the most interesting thing is the take rate, the participation rate. It's only 50% at the highest of any of my healthcare provider clients on a voluntary basis, which is strange and kind of frightening to me as a non-healthcare person, that a healthcare person would say, no, I'm not going to take this vaccine. I think, unfortunately, it's, early on, it's been a product of, and they were the first ones that got it, remember, that it's been a product of politics too much. And I think that has sort of tainted what the numbers will ultimately be. But I think that so the short answer is yes, you can mandate it. There's a couple of exceptions I'll talk about later, the legal exceptions, but yes, you can. The bigger question is, should you, in terms of employee morale? Are you going to force or ramrod this down the employees' throats? And then there's a lot of legal considerations to be discussed about that. And I understand we have some questions specifically about that, so I'll reserve to answer those legal questions when we get to them.
Yeah, Suzanne, I found the same thing with the majority of my clients. It's been, who are eligible to get the vaccine. It's been very surprising, to Greg's point about the take rate. I think that time will tell. The concern about reaction or coming out too early, or all of the things that we have heard are cause for concern, which we know have been the leaders in in this space have said this is perfectly safe and we're all taking this, and there's not a lot of data behind any concern about the vaccine, and quite the opposite. But the employers that I work with have talked about just what Greg said, morale, and continuing in this theme of empathy and understanding, and wanting people to feel comfortable, and that their employers working with them, understanding their concerns, and really not making this a mandate. I've had a couple employers, and to Greg's point, we might talk about this later, a couple of employers who have worried about somebody getting a bad reaction, and if it's mandatory, or somebody feeling like it's a violation of their religious beliefs, and how that can translate into potential discrimination. So, would be an important dialogue as we continue the conversation.
And I also think that when you're talking about vaccine policy considerations, that the primary question really has to be, how do you create a system that maximizes the safety of your staff and families while minimizing exposure to liability? Mm-hmm. So, you need to determine the level of risk your staff are exposed to. There's more risk in a school setting or a center versus obviously telehealth. And obviously working with an attorney like Greg to determine the legality of creating a policy or not creating a policy. There may be legal mandates in the future, but there aren't right now. And this is going to vary from state to state. And determining potential liabilities for creating versus not creating policies, because you can create liabilities on both sides. You may be liable for not creating a safe environment if you don't have a policy, and you might be liable if somebody gets sick from not creating a policy. And on the other hand, if there's an outbreak in your, in your school and you don't have a policy, then you also could be liable. And what is like Greg and Amy said, you also need to consider the impact on company culture. Some people may object, which can only cause a polarizing environment. Another thing, when thinking about this is, you'll need to have a plan for accommodations if people, claim exemptions, medical, religious, philosophic, there's 48 states that recognize religious exemptions and 15 that recognizes philosophic exemptions. So how will those people be utilized if a policy is created? Can you accommodate that? Can you accommodate them? Weighing in on employee morale and the potential turnover, how is this going to impact your business? Will you have employees to provide services for your clients? Lastly, what is the fiscal impact to your organization? Because you may have to pay for people's time to get vaccinated. So I think that there's multiple factors to consider. And I think, yes, we can mandate a policy for vaccines, but there's pros and cons on both sides.
So one of the questions that I've personally had is, let's say you have a longtime employee or just a very valued employee who has an underlying medical condition that prohibits them from getting a vaccine. So can you exclude that person? Do you exclude the pregnant person? I mean, how do you design that so that it's fair and can be administered in a way that is going to protect the organization?
Well, I'll start with that because I think, Suzanne, the law already provides for that under the Americans with Disabilities Act or state Fair Employment Practices Acts that prohibit discrimination against individuals with disabilities. And so you have to engage in the interactive process with that individual and find out, is this just a fear, an unnatural fear, or do they have COPD? Do they have some heart condition, some underlying condition that puts them at great risk of maybe some sort of, reaction to the vaccination? And you would have already had some of this discussion with them probably if you're already called your people back to work and they said, no, I want to work remotely, and so you go through the same calculus and it's there. And it was alluded to, you do have a duty to accommodate, reasonably accommodate your employees. And that may be through that interactive process that you decide that person doesn't have to be vaccinated or doesn't have to come back to work yet. But you also, though, have the option that if that person would pose a direct threat to himself or herself or others, that you can then say, well, I can't accommodate that because not getting the vaccine is going to, and you come back to work and you're going to be working with clients and potentially exposing them to COVID. We can't have that. Or you could, be bringing the disease into the workplace and affecting others, because we still don't know that when you get the vaccine that you still can't get COVID. We don't know what we don't know yet, unfortunately, with the science. We've heard things, all over the place. I have at least. And so you just go through the regular calculus that you would under the ADA, but also the reference to religious, a sincerely held religious belief. And I've been through this with my healthcare clients for just the regular flu vaccine. Nurses that say that my religion precludes me from taking this vaccine, and you see if you can accommodate that or not. And you can do that by saying, okay, well, if you don't take the vaccine, then you will wear PPE, a certain level higher than what you already have to wear, or things like that. That might be a reasonable accommodation. Or maybe they're not patient front. You move them into another position that's not patient fronting. So those are the considerations. And then if you do require it, you also have the Genetic Information Non-Discrimination Act, the GINA Act, that you got to make sure that when you're asking questions, and I would certainly advise clients that they should use a third party to ask the questions, because when you do mandate it, somebody's going to take the vaccine, you have to find out whether they're going to put themselves at risk by taking it. And you've got to protect that information, and you got to make sure you're not asking family history questions that it could lead to a GINA claim. And then finally, I think Heather said this, that it's absolutely right. If you mandate it, then you have to worry about the FLSA too for non-exempt employees. If you're mandating that they do something, they're going to get paid for it. For your exempt, salary exempt people, that's already something you can make them do without paying them. But you might want to further incentivize them. Some of my clients that make it voluntary, and especially in healthcare and in education, they want to incentivize it by offering, not only to pay it, or a certain number of hours of pay, or banked PTO, or gift cards, or things like that. But you also need to educate them about their rights in advance, because it always comes down to employee morale. Because even if you do this right legally, remember, they may be, if you have enough employees, they may be so up in arms that they then say, you know what, let's go ahead and try to organize and form a union in this workplace. So that because we believe the union would be able to tell the employer, no, you can't force this. Well, that's probably not the case, but that's what employees might think. So it's all about treating your employees fairly, so that you can avoid having any litigation challenges or somebody trying to organize your workplace.
So you hit on something that's then another hot topic in a lot of discussions that have popped up in the last couple of weeks, and that's the idea of incentivizing employees, whether giving them a bonus or a gift card for getting vaccinated. Some people feel like it's coercion. Would you all like to comment on that?
I think education for vaccines is important. I think supplying the scientific reasoning behind and explaining how this is beneficial is extremely important. I'm not sure that I would incentivize. That's just my personal opinion. I wouldn't incentivize somebody for taking a vaccine, because I don't want any of our staff to feel like it's discrimination. I'm giving one person, you're taking a vaccine, so I'm giving you a reward for this. And if somebody else opts not to take it, that they're getting nothing. So I personally would err on the side of caution with that.
If I could jump in and underscore that, Heather, you make a great point about discrimination. Keith Sonderling, who's the former chair of the EEOC, just last week said that the EEOC hasn't taken a position on incentives yet. And so, it underscores your point about there's potential for a discrimination claim there.
Yeah, I'll add, incentives in the healthcare space are always talked about, especially around the wellness. And while this is sort of kind of a wellness vaccine falls into a wellness category, what you always find with incentives is you end up paying people that didn't need to be incented to begin with. And someone in this case who doesn't want to get vaccinated, a $50 Amazon gift card isn't going to be the incentive. I think, Heather, when you said education, really that's what's going to change the person's mind who is reluctant to get a vaccine. So, when we talk about incentives, especially in the wellness space, again, you want to give somebody, to use an example, $50 to go do their steps. It's usually the marathon runner that's out there going and doing it, who you didn't need to incentivize, right? So we don't really push those in any capacity. But I think again, Heather nailed it in this case, and in any case with wellness, really education is the best option.
Yeah, I love that, Phil, that you reached back in history, because we don't have a lot of history to fall back on in these situations. We've always had to sort of talk it through and be reactive. But when you look at wellness efforts in one of my jobs as an HR executive, we did a health check and incentivized people to get their BMI checked and their blood pressure on site, and they got a $50 gas card or something. And funny story is the chief marketing officer came into my office and said, great, I got a $25 gift card, but now I know I'm fat. And it was like turned into this whole morale issue of, this, I didn't expect to feel badly about myself coming out of this. So you're right. If we have to turn to history, we do have some experience with incentive in the wellness space, which hasn't always resulted in positive employee experience or reduction in health rates or any of those things. So I love that you pulled on that.
So Greg, you also touched on that an employer might be liable if an employee has an adverse reaction to the vaccine. Could you circle back to that?
Sure. There's a couple of lines of thinking here. There's several issues, and this is sort of the lawyer's dream, I guess, if this happens, the plaintiff's personal injury dream, that they would bring a claim like this. And there is a vaccine court in Washington, D.C. for the MMR and some other, national long historical vaccines that we've had. This would be different, though. This would be something that is being required by an employer, because you don't require MMR or tetanus usually. There's some jobs that you might require that, but for employment, you would require this. And so the first question is this covered by workers' comp exclusivity? If there is some sort of injury or even death of the person that receives the vaccine, what is their tort? What's the employer's tort liability? And I think if you make it a condition of the job that you have to do this, and then they get injured, that of course you need to talk to your carrier, but the carriers may say, well, I don't know that they could prove causation or not, but I think from the employer's perspective, you want this to be covered by workers' comp, because that then limits the liability that you have as an organization to that exclusive liability under the workers' comp system. There is, though, just so you all know, that there's a federal statute that would provide immunity to employers that mandate it. It's called the PrEP Act, and it is, it hasn't been tested yet, but it's the reason that was put into a statute already by Congress is to incentivize employers to require this. But there's no federal law or state law that I'm aware of that mandates, that says employers have to require the vaccine. There's also, likewise, no federal law or state law that says that employers can't mandate it. And that's why I say the normal laws that we have in place are the calculus that we have to operate under. But that PrEP Act is encouraging in terms of limiting liability to employers for requiring vaccinations, and then, of course, the workers' comp exclusivity. But I would think Phil or Amy could add something more to that, because they deal with workers' comp claims more frequently than I do, probably. So,
yeah, from my perspective, it's still a lot of the unknown. We're still going to have to wait and see what gets defined as qualifying. So I don't have a lot of experience to fall back on when it comes to workers' comp claim, but Greg, I agree. It's certainly an area to keep an eye on, because, as you said in the beginning, which I said to myself, we're all sort of, as HR professionals, waiting for the tidal wave of what this is all going to mean from a litigation standpoint. I think the atmosphere through the pandemic thus far has been, let's just buckle down and get through this and be empathetic and try to all do the best we can do to get our jobs done and, be there for one another. It remains to be seen once, the stay-at-home starts to lift and people start to not want to get vaccines. And so I think workers' comp is already a delicate area in terms of what qualifies and what doesn't. And I'm hopeful that it won't get to contentious workers' comp situations that are, wide in impact, that hopefully we can face this off as professionals before it becomes a workers' comp situation.
Any other comments on that one? So Heather, how has COVID impacted employee-employer relations, onboarding, retention? Have you not only seen an impact, but come up with some solutions for that?
That's a good question. I think that, employee relations, has been impacted, some for the good, some for the bad. I think that we put out a survey because we've been trying to make sure that we're staying connected to our staff. So we're consistently putting out surveys to take everybody's temperature, to find out where they're at. We're trying to give people platforms to connect with us. But because people are not in person, I think it is truly impacted company culture, because people people want to be around people. And so, Zoom has been a good approximation for us, for interviews, reviews, disciplinary actions. They all can be conducted through the platform and followed up with by emails. We've had a greater participation in our online community. We utilize a program called Workplace, which is basically Facebook for business, so that we can communicate. We can put out videos to our staff. They can still communicate with each other, so that there is some sort of engagement. I also think that some of our staff are more productive working from home, and they're thriving because they're happier that they can spend more time with their family, and their pets. But in the same breath, I think that other staff have struggled working from home and are not doing so well in isolation. It's also easier for employees to hide and delay their responses when they're not faced with having to interact in person. So from an employer relations standpoint, we've had our challenges. The onboarding process, we're thanks to advances in technology, and we have an entire HR platform that we utilize through Paylocity. And so we can onboard and do all, documents onboard, and they live on, onboarding documents, and they live in the cloud. And most of our onboarding is conducted virtually. So we've been doing most of our classroom-based trainings. We've been doing them online. There are certain trainings that we still have to do in person, and we have limited the amount of people that are training in groups. So we have, small groups, and we're following, safety protocols and providing protective equipment, and so on and so forth. And we are able to deliver protective equipment to our staff by, our supervisors are, they're making sure that all of our staff have protective equipment. We're just trying to do our best to limit the exposure during the onboarding experience, the in-person exposure, while trying to bring everybody in, into the fold and make them feel welcome and feel like they're part of the company, because in non-COVID times, working, in home or in school can be isolating because it's just you and the client. And so now with COVID on top of it, it adds an extra layer of isolation. And so how do you get people involved? How do you make them feel that they're part of something bigger? So, we've worked on that. And, in regards to retention, it's been, when COVID first started, I think that many employees they wanted to be employed. They didn't want to look for a job during the pandemic, because they saw that as too much of a risk to start something new. But as COVID has gone on and on and on, I think some people have been fearful to work, and have resigned because they don't want to work, or there's been resignations because of unemployment, and they're able to access unemployment benefits. In some instances, unemployment gains were greater than, actual paychecks. So, it has been, it's definitely been challenging. But I think that, if we've just tried to get our staff to be as engaged as possible and make sure that their supervisors are checking in, make sure HR is checking in, and let them know that we're really there for them.
Great, that's great. Thank you. Amy, do you think that COVID has impacted the use of employee time off, work performance? Do you think having a vaccinated workforce will impact that in the future?
So when it comes to paid time off, the interesting data out there cross industry is that for those people that were able to work remotely, so non-essential, non-manufacturing, people who could work remotely, they're taking less time off. They're behind their desks from the beginning of the day to the end of the day, and sort of have felt for some reason that because they're working from home, it's sort of like a vacation, and even though they're working hard. So it's been a conundrum for a lot of employers, and my advice has been, as leaders, and feeding on what Heather said, this has been a real test in leadership, learning how to lead remotely, and learning how to model the way when it comes to taking time off. So prior to the pandemic, and the conversation has still been sort of trending, but there are a lot of organizations that started considering, what was termed then unlimited time off, or we don't track time off and just take it as you need it, which has its pros and cons. But I think that during the pandemic, it became harder to track people's time off. And it was a time for us to all, as leaders, reflect on what's the bottom line objective that we want for our business when it comes to time off and how we utilize our policies. If we're an organization that is hurt fiscally or from a product production standpoint because people call out sick, those are organizations that might want to consider having a paid time off bank instead of separating time into vacation, sick, personal. Now, the financial burden of that is if you put it all under one umbrella. In many states, like in Massachusetts where I am, you have to pay out the unused and accrued time off when somebody leaves. So if you're putting all that time into one bucket, it leaves your liability as to what you have to pay out a little bigger. But the decision is, which is more of a risk, having that liability or having people call out? And for a lot of organizations that need people on the job, the negative impact is having them call out. So COVID has actually, I think, made a lot of, at least my clients, start to reflect on their policy. The one thing that I can know, as Heather said, with onboarding has been pretty much a remote process prior to day one over the past 5 years anyway, because of the great technology that we have. But retention and employee relations have changed dramatically since the pandemic. And we have seen a tremendous uptick in turnover in the past, particularly the last quarter of 2020, and then continuing starting in the end of January. And I think a lot of that has to do with how employees felt treated during the pandemic. And I think there's a lot of other organizations that have put new, really cool employee retention and perks into their work life that have made people start to think about new opportunities. And the one thing that I'll also point out as a part of just employee relations and retention is that I think that the world of working remotely is forever changed. I've seen candidates, top talent in the workforce, not have it be a preferred, a lot. Traditionally, when employees are being recruited, they do the best they can do until they're offered a job. And then once they're offered a job, they say, would it be possible for me to work a day from home? Now candidates are stating that before they even interview. This is now I need to be at home 2 to 3 days a week. So that whole, and I don't know if you guys have seen, but job postings actually say now, once the opportunity is there, we will be back in the office 5 days a week. And we found that that's cut the applications from some of the top talent out there, just because of what the pandemic has done from a retention standpoint. So certainly changed a lot of things in how we look at paid time off policy and retention, not so much from my perspective on onboarding.
So let me ask you this. We've heard that the extra COVID 2-week payout for FMLA coverage is going to end in March. So my question is, how will that impact us as organizations? Do you think that people will be more likely to come to work after either being exposed or having symptoms? And, you know, if staying home with pay is no longer an option, you know, what can we as employers do to maybe make up the gap for that? And is this a state by state issue or is it nationwide? So pick one.
Yeah, so I'll lean on Greg to help me with this one, because I think, first of all, the March 31st date is, we'll see if that holds true, kind of where the numbers and the vaccines are and whether there's extension. I haven't heard any murmurings of that getting extended at all. You know, if the date holds, we also have in many states, Massachusetts being one of them, a new paid family leave act that this is the first year that people are able to start getting paid out and submit claims to get paid during leave. The one question that hasn't been answered is, does COVID qualify as a you know, serious illness? So that's a big question mark as to whether people will be able to use paid leave time through the Paid Family Leave Act, and the new ability to get paid that way is still a big question mark. The only thing that I would say, other than it's sort of a wait and see game, is I always make sure that employers are not encouraging people to come in when they're sick through policy. So there's a lot of organizations that will pay people out for unused time. So they actually, you know, get a big bonus at the end of the year because they've saved up a lot of paid time off. I've really encouraged employers to rethink that, not only because it's a big liability financially, but it sort of encourages people to come in when they're sick. And then again, to just model the way as leaders. You know, if your workforce is seeing you come in with a cough or a stuffy nose, then they're going to think that that's the expectation. So, you know, just make sure to model the way.
So I'm going to switch gears a little bit, Phil. What should we be looking for when it's time to renew our medical or other insurance policies so that we can provide the most comprehensive medical care and options for our employees?
Sure. So there's a couple of things come renewal time that are important this year. And I'll speak to especially companies that are larger, that are their claims experience come into play. The first and foremost is subtle plan design changes and network changes and pharmacy benefit changes. Those are all things right now that carriers are using, even pre-COVID, to try to maintain or whittle down their renewal increases. So you have to be kind of careful there of those minor things and make sure that what you're getting, you're actually getting, and you're not taking a benefit away from your employees. You know, it's quick and easy to say, okay, we'll shift the cost. We'll shift the cost in terms of deductibles or in copays, and we're seeing copays go, you know, get close to $70, $80 in some cases, which doesn't really seem like a copay anymore. So that's something to pay attention to, of course, whether it's a small or a big change. With prescriptions, which are so highly used, the carriers have been zeroed in on that for several years now. And it's good if you can get the utilization to see what scripts are being used. Are those scripts still falling into the same drug tiers? Did the carrier or the provider you're using change their pharmacy benefit management company that's going to shift where the scripts fall and what scripts are covered? Those are always very important. In terms of people looking at their renewal, and this is an important one because this is something that is directly COVID related. The insurance carriers are building in their rating models or their renewal models a factor for COVID. And it's a bogus factor for sure. So this is something that, you know, when carriers go through and the underwriters draw up your renewal, they break it down into different categories and they're putting numerical values and percentage increases based on the different areas of your plan. a lot of the carriers are factoring in claims that didn't happen because of COVID, because COVID came in and trips to the doctor came to a grinding halt. Nobody was going in for anything minor. Nobody was going in if they didn't have to. So claims experience really dropped off for the months of COVID. But the carriers are claiming that these claims are all going to come back. So it's like an expected claim, but not received yet. And to the tune of about 14% that they're putting on as they're working through their model. So you have to kind of dig through that and make sure that they're not trying to pull something on you when it comes to negotiating, looking at your renewal, what the cost is, because they are going to try. They have this fear that there's going to be this wave of claims that didn't take place due to COVID that are going to catch up. There's some degree of truth to that. Yes, there are some surgeries that will be put off. But, you know, if you think about someone who got poison ivy or a minor injury that recovered on itself, those people aren't going back to the doctor for that. So those claims never happen. So really, it's a year where if you have claim experience or you're rated that, you really need to focus in on that. Make sure whoever you're working with is really picking that apart and calling the carriers out on any of, you know, kind of the shenanigans that you're doing with their math to try to get more money out of you.
I do wonder what the percentage of people who've had their teeth cleaned this year is. It just seems too invasive.
And on that side, you know, most of dental, life, vision, they just rate past because those claims are those are gone. Those will never come back. But the medical carriers are trying to be a little sneaky.
So, what are our options if an employee says they're too afraid to return to work? And should this be handled differently than when an employee has an underlying medical issue?
So I'll jump on that one first and say that you need to find out why they're afraid to return to work. Again, this triggers the interactive process. Is it just a fear? We all have a fear of COVID, or is it because they have some underlying conditions, or they have somebody in their household that has some really risky conditions if they're exposed to COVID? So you have to engage in that process with them, and you need to determine whether you have to have an ADA discussion or, a disability, state fair and practice employment practices, or even a local disability policy discussion with them. You also need to determine, do they have a serious health condition that could be aggravated by getting COVID, and therefore, because, whether COVID's a serious health condition or not, probably the courts will say it is, but maybe not. But it's a pretty serious impact on you that requires continuing care or require a hospital stay depending on when you have it. But it ranges. Obviously, it's an individual effect of COVID. But they may have a serious health condition that can be impacted by it, like asthma or something that will qualify as a serious health condition. So you need to look and see, have they utilized their FMLA? Have they used their eFMLA? Which to Amy's point, right now it sunsetted on December 31st, but you can voluntarily take advantage of it, the tax advantages of it, through March 31st. And with this COVID stimulus bill before Congress right now and in the news, packed in there is an extension of that that would be mandatory extension of that through March 31st, but it hasn't passed yet. So you have to look at that issue. And, you also, of course, from an employee morale issue, do you really, if it's a really good employee, are you going to give them that Hobson's choice of either quit or come to work, or are you going to work with them? And if you do work with them, are you then exposing yourself to a discrimination claim? Are you only going to do this only allow people that are older to stay home, which is ageism, to make that assumption? Just because they're older, they're more at risk. It can have a disparate impact, obviously, on them, and certainly a disparate treatment. And so you have to go through all of that calculus. You also think about, you have a general duty under OSHA to provide a safe workplace. And is this going to be a safe workplace? Are you actually taking all the precautions that the CDC recommends? Even though it's not law, it's guidance, and you should be taking those precautions if you're going to require people to come back to work. Has that employee made a claim that you are not following OSHA guidelines? Are they therefore protected? And if you say, I'm going to fire you if you don't come back, is that retaliation? Are they a whistleblower? I could go on and on, Suzanne. It's, the amount of potential claims that you have to go through. But I would start with, if a client called me, first thing I'd say, is that employee an at-will employee? In other words, do they have a term of employment? Do you have a union? And then I would go cascading down through the ADA, the FMLA, finding out if it applies or not to the employer, down to have they complained about working conditions and things like that. And that's a call that I get very frequently, and it's a lengthy call. And it's, you need to, for those of you out there that are in multiple jurisdictions, different jurisdictions than I am, I'm just in Florida, and that's what I give advice on, is Florida and Florida local and county governments and Florida law and federal law in Florida. You definitely, if you're going to give somebody the Hobson's choice of quitting or being terminated or coming to work, you need to talk to your counsel, because that is where you are going to get sued if you end up firing them.
So I'm breaking in, guys, because we do have a question from the Fort Law Group. And Greg, I'm not sure if you hit this while I was waiting or not. I'm trying to monitor a couple of things, but the question is, can an employer mandate a part-time employee to get COVID tested if they suspect they have the virus?
Yes. Yeah, you have a duty to provide a safe workplace. So absolutely, you can mandate that a part-time, full-time employee, vendors that come into your workplace get tested before they come into your workplace. If that's what you choose to do, as opposed to, you could ask them the COVID-related questions, take their temperature, require them to wear PPE, things like that. But the bottom line is, yes, in Florida, you can absolutely mandate a part-time employee to go get a COVID test, a negative COVID test, before you let them back into work.
Greg, is there any risk to that if it's just based on symptoms? It's not an overall requirement for testing, that you're sort of self-diagnosing or suspecting based on symptoms?
Sure, that if you mean the risk to somebody coming in and exposing your employees to that,
or you see an employee that's coughing and you say, you got to get out of here. I've had a lot of questions along those lines, that can you demand a test of an employee based on symptoms that you've observed?
Yes, you can. And you can send them home and require them to establish that they're fit for duty, because you have that general duty to provide a safe workplace. And OSHA just issued a new guidance last week. This new administration is going to be pushing OSHA to push employers harder on this, including the guidance says send employees home, make them work remotely. That is going to cause some tension with the EEOC, because that may have, lead to age claims. It may lead to perceived disability claims. And so this is going to be a difficult thing. But I do want to point out that it just has to be common sense, and you need to try to get, the employee buy-in and tell them that, this is not only good for your business, but it's good for them. And if you can, if they have PTO or they may qualify, at least through March 31st, the employer can get a payroll tax credit if you give them the paid sick leave, if they qualify, or the extended family medical leave. Even if you don't have, FML doesn't apply to you, it now goes down to one employee, at least voluntarily, through March 31st. So it's a discussion with your employee. But, if they're just got the sniffles, where it really comes up, Amy, I'm glad you brought this up, is that it's not really you observing it. It's an employee complaining that, oh, gee, Matt is, he just looks like hell. He's coughing like crazy. I can't be around Matt, and it's just an employee relations problem when that happens. And are you then going to go ask questions based on that or not? You just need to use common sense and not overreact. Initially, because of the fear of this pandemic, people overreacted. And the practical response is just pay the people, get them out of the workplace, tell them they have to go get a fitness for duty note, which may or may not include a COVID test, depending upon what their doctor says.
So the other thing is that to add to that, those of us who work in schools, at least in some states, they've issued guidelines. So New York, Massachusetts, and Connecticut, for example, have done that. If you're in a state that hasn't done that, I think a good resource would be to look at Connecticut, Massachusetts, New York, or any other state near you to see what some of their guidelines are about what they're recommending in terms of being able to stay in the workplace or return to work, or honestly, anything else COVID related. So we are coming up on, oh, I'm sorry, Heather, go ahead.
Oh, I was just going to piggyback on that and say that it's important to be preemptive and make sure that you have consent forms for your staff if they're providing services at this time in person, that you have them sign consent forms. Also having them complete a daily health screener so that they're attesting to COVID related items. And if they answer, yes to any of those, that sets off an alarm to contact them and not let them come into the workplace. And if they do show up and you have an hourly employee, then you can pay them for reporting time for showing up, and then give them the option that they can either go and test or they can quarantine for 14 days.
So we are just about out of time. So if each of you have a parting thought for our participants, have at it.
I'll just start, and then I've said probably too much, but the one thing I want to leave you with is, and this is not self-serving, you don't have to call me, but if you're not sure, definitely call your attorney. As we're coming out of this, as we've said, and Amy and I'm sure Heather agree, and Phil would agree too, that there's a coming wave of litigation. People have been respectful, I think, of everybody being in this together now, but we're going to come back to normal, and we're going to have lawyers filing lawsuits like crazy about this. So a 15 to 20 minute or even 30-minute phone call, I can assure you people, is a lot cheaper than a lawsuit.
I'll mirror
Yeah,
that.
I'll,
Oh, go ahead, Phil.
Oh, sorry. I was just going to add that, be prepared for the return to work when it does happen, especially from an HR standpoint. People got used to this, how this is and how we've been living. So make sure you do have a good plan in place. Keep in mind what your employees will be going through from a mental health standpoint as they have to now transition back, and how that's going to impact your workforce. And unfortunately, make sure that we just don't forget about this and be prepared in case this happens again, and use this as an opportunity to put a plan in place for, God forbid, if this does happen again.
I was just going to mirror what Greg said about having a labor attorney or employment lawyer. Every HR professional's best friend. And to just remember that positive employee experience is more valuable than anything when it comes to productivity, the reduction of litigation risk, and retention. So just keep thinking about that employee experience and what is the right thing to do.
Heather, anything you wanted to say before we close up?
No, 1,000% you should have a really good labor attorney.
So I will just share this one thought with you, even though I'm not a panelist, is that what I have experienced since last March is that some of our employees have really risen to the challenge. They've proved themselves to be dedicated, creative, going above and beyond. And I would encourage everybody out there to remember that when the time comes, and to invest in those people for the future, because they're the ones who are going to help us get to the next level of all of this. So with that, I would like to thank each of our panelists. You guys, this was great. Thank you so much for coming and volunteering your time to help behavior analysts all over the country. So thank you.
Thanks
Thanks
for
for
having us.
having us. See you guys.
And I want to say thank you to everybody as well. You guys are doing amazing. These are really difficult times, so stay safe and be well.